In addition to the ABCs of safe sleep, the American Academy of Pediatrics has a few more suggestions to reduce the risk of sleep-related infant deaths. For infants in your program that use a pacifier, offering them a pacifier while they sleep may help to reduce sleep-related infant deaths. However, do not use pacifier clips or toys that attach to pacifiers. The ribbons or string could become wrapped around a baby's neck and lead to strangulation. If a pacifier falls out while the infant is sleeping, you do not need to reinsert it. And of course, you should never force an infant who refuses a pacifier to take one. You should also keep your child care program free of any tobacco smoke. Exposure to secondhand tobacco smoke is known to increase infants' risk of a sleep-related death. Finally, research suggests that supervised tummy time while an infant is awake is a good way to build the muscles that help infants move if their breathing is ever blocked. Most infants can be placed on their stomachs while awake for short periods of time, immediately after they arrive home from the hospital. During this tummy time, an infant should always be supervised by an adult. Slowly, over time, you can increase the amount of time an infant spends on their tummy until they get to at least 15 to 30 minutes a day by 7 weeks of age. It may be sooner or later for some infants, so keep a close eye on their tummy time. Tummy time should not be confused with placing an infant on their stomach to sleep. Tummy time should always be done when an infant is awake and when you are closely supervising them. Before we move on, I also wanted to share a few recommendations for families. These recommendations might not influence any actions you take in your own child care program, but they may be important recommendations you wish to share with families. These things will help babies sleeping safely at home as well. First, evidence suggests that consuming breast milk is linked to a lower risk of sleep-related deaths in infancy. It is important to consider and respect that not all families want to or are able to breastfeed their infants. However, if you have a family who is asking your opinion on feeding their baby formula versus breast milk, you can share that breast milk may reduce the risk of sleep-related infant deaths. The American Academy of Pediatrics recommends that infants be fed only breast milk for at least 6 months. Families can continue breastfeeding for 1 year or longer as long as it is something the caregiver and infant both desire. You can also recommend that caregivers should not sleep on the same bed or surface as their infant. Instead, room sharing is recommended by the American Academy of Pediatrics. Room sharing is where an infant remains in the same room as a caregiver, but sleeps on a separate surface from the caregiver, such as in a crib. Sharing a room with an infant helps with feeding and allows caregivers to monitor their baby more closely. It also reduces the risk of sleep-related death by nearly 50%. Sharing a bed or sleeping surface with an infant, however, poses serious and dangerous risks. So, remember, safe sleep can be accomplished by remembering your ABCs. Always place an infant to sleep alone, on their back, and in a crib. These are simple steps you can take to ensure a healthy future for the infants you care for. For the next few minutes, you will answer some questions to check your understanding of what you have learned so far.